The next category of injury prevention that we're going to talk about is in traffic safety. And our resident expert in this area is Dr. Carol Cotton, who's on the faculty here in the Department of Health Promotion and Behavior, and also Director of the Traffic Safety Research and Evaluation Group. Well, Carol, when we talk about traffic safety, what are we really talking about? Who does it affect?
Well, it affects everyone. It affects, you might think it was just cars, but it's also commercial vehicles as well. Things like buses and trucks, but also pickup trucks, pedestrians, motorcycles, scooters. If you think about it, from the very first day of your life, when you leave the hospital, the first thing you do is get in a car, generally speaking. And particularly the last day of your life, you might be in a motor vehicle as well.
Okay, well, regarding fatal motor vehicle crashes, where are the most dangerous places, and when is the most dangerous time to be on the highway?
Well, motor vehicles are the leading cause of death for everyone from ages 1 to 34. That's a large age range. It affects, again, everyone. Men are mostly involved with fatal crashes and our fatalities, and it's generally speaking the drivers in the car. But where they occur is in the rural areas, primarily. Much more than half of our fatalities occur in our rural areas. But also it might surprise you that the time when fatal crashes occur is from 3 o'clock to 9 o'clock in the evening, not that very, very late time at night. 3 o'clock because our teens are leaving school and they might not be paying attention to their driving. And at 5 o'clock we have adults who are leaving work and might be fatigued or not have anything to eat. And then we have dusk, which is a time where it's very difficult for humans to adjust their eyes to the lessening light.
Well, tell us about some of the ways that traffic safety has improved over the past couple of decades.
Well, we think about that as the 3 E's: education, enforcement, and engineering. Engineering on our roads as well as our cars. Our roads are engineered better. They have longer sight distances, better lines, they have better asphalt, we have guardrails, we have cables that protect our cars from moving off of the roads, we have better shoulders, those kinds of things. Our cars are better engineered in ways that we can see, but also in ways that we can't see. We have seat belts now that are in the front seat as well as in the back seat, in every seat. We have airbags that are available to us, front as well as side. But you might not know of things that are in your car that you can't see that protect you, things like tempered glass, so the glass doesn't break and injure you. We also have enforced roll cages that protect the car when it's in a rollover and it doesn't get crushed. We have crumple zones that protect you from the engine moving back into your body in a crash.
Well, let's talk about some of the more negative sides of this traffic safety matrix, and that, of course, is alcohol. How's alcohol impacting on traffic safety?
Alcohol is a major part of traffic safety. It is involved in 1/3 of all of our fatal crashes and our fatalities. So if people would stop drinking and driving, we could save 10,000 lives a year.
But what are some strategies that are used to reduce drinking and driving? Well, what can the average person do?
The average person can really do a lot. First thing is you want to monitor your own drinking. When you're out, make sure that you're not drinking too much and then trying to drive home. Get a designated driver, someone who can care for you, someone who can take you home. Or have a place to stay that night if you think that you're going to be drinking a lot. But also as a friend, you want to monitor your friends' drinking. If you think that someone's been drinking too much, try to get the keys from them before they get in their car or offer to take them home. Society, though, has passed several laws that prevent or deter drinking and driving. Our .08 BAC law is in every state in the nation. And that means that people that have a .08 alcohol content or greater are too impaired to drive. We also have a minimum drinking age law. We also have graduated driver's licenses laws.
Let's go to the other contributing factor, major contributing factor to so many traffic fatalities, and that is speeding. Speeding is something I think we've all done at one time or another. As a father of a number of teenagers, I've had firsthand experience with that. And what's the real problem with speeding?
Well, there are 2 ways that there's a problem with speeding. One is the faster you go, the more likely it is that you're going to make some mistake and then it'll be catastrophic. So you do want to slow down. But the other problem is that not all cars are going the same speed. One of the things that makes our interstates a bit safer is that cars go about the same speed, and that's safer. If cars go different speeds, then it's the closure rate that's the problem.
Well, if you're tempted to speed, what can a driver do to resist that temptation to speed up?
Well, I want to say get up earlier, but all kidding aside, that you need to understand that the reaction time you have when you speed is much less. You have less time to assess danger and then to get out of that danger. So our speeding is our second leading cause of fatal crashes in this country. So again, we could save another 10,000 lives if people would just slow down.
So we have 10,000 being killed due to the speeding issue, 10,000 fatalities here due to alcohol. So that's 20,000 people a year. In 3 years, that's as many people as we lost in Vietnam.
That's right.
Yeah.
That's right.
That shows a real public health impact. Going over traffic safety with Dr. Carol Cotton. And I have to tell you, Carol, do safety belts really work?
Safety belts really do work. Our nationwide safety belt usage rate is 84%, which is up from 2002. But over half of our fatalities are unrestrained. Our belts really do work. They do save lives.
But what other safety equipment should people be using?
Well, certainly you need to always turn on the airbags that are in your car. Don't turn those off unless you have a young adult in the front seat or a small person in the front seat, a small adult. Then you can turn your airbag off, but they should always be on in other cases. But also you need to be wearing bike helmets. Those are safety equipment for traffic safety. But not only wearing them correctly. Make sure that they're fit by a professional. Also, if you ride a motorcycle, make sure that you're wearing your motorcycle helmet. We know clearly in states that repeal motorcycle helmet laws that more people die in those states.
Well, let's talk about distracted driving. That's been in the news a lot. There's a lot of legislation that's been going on and revolving around that. What are we talking about when we talk about distracted driving?
Well, you might think that it's only texting or cell phone use, but it's much more than that. It includes anything that distracts you from your driving, things like being drowsy or eating or reaching in the back seat or talking to passengers or adjusting your radio. All take your attention away from your driving, and anything that does that is considered distracted driving.
Well, lately, texting while driving or cell phone use while driving has been a topic of big interest, particularly with legislators. Why is using a cell phone or texting so dangerous to traffic safety?
Well, texting is particularly dangerous. If you think about that driving is a physical skill. It's something you have to do with your body. Turn your head, react, turn your arms, move your legs. It's also a cognitive skill. You have to use your judgment. So you have to attend to it. You have to pay attention. So when you're texting, your keyboard on your phone doesn't tell you what key is what letter. So you actually have to look at it, A or B and whatever you're trying to type. And then you have to take a look at your message to see if you've spelled it correctly and who you're sending it to. So it takes all of your attention away from your driving. Cell phone use, it's just like talking to other passengers, and you're not really paying attention to your driving.
Well, you mentioned drowsy driving. What can people do to reduce the danger from feeling sleepy behind the wheel?
Oh, drowsy driving is very dangerous because, as you know, when you're sleepy, your body does not care what it is that you're doing. It's going to go to sleep. The same thing with driving. Just because you're driving isn't enough to keep your body from falling asleep. You need to make sure that if you're taking a long trip, that you get enough sleep the night before. But in the case where you feel drowsy, you need to pull over, safely get off the roadway, and get out of the car. Maybe go get a cup of coffee, walk around your vehicle, maybe make a call if you're outside your car, talk to somebody. In the case where you absolutely cannot wake yourself up, you need to pull off the road safely, maybe a rest stop, and take a nap.
Boy, I feel like I'm talking to my teenage drivers with these instructions. But aren't some people just bad drivers? What can we do to be better drivers and improve overall traffic safety?
We hope that there aren't bad drivers out there. We were all trained to be good drivers. Maybe we've picked up some bad habits over the years. But what we can do is to obey the traffic laws. When the stop sign says stop, then you must come to a complete stop. Don't think it doesn't apply to you. But also things like don't tailgate. Tailgating is very dangerous. The idea that you can predict what other drivers are going to do safely when you're right up against them is just wrong. You can't. They're going to do things that are unpredictable. But also you want to maintain your lane, for example. And the way to maintain your lane is when you shift lanes, count 1001, 1002, and then move to the next lane. If you go any faster than that from lane to lane, you're considered weaving.
Well, thank you, Carol. That's a a lot of impact on public health just from these kinds of preventable injuries like they have here in traffic safety. Well, that was a compelling section, Phaedra, on the tens of thousands of traffic fatalities and injuries.
Yeah, I'm a commuter, Tim, and I'll tell you, 2 hours in the car every day. I cannot tell you the number of people that I see on their cell phone, texting. It's incredible.
Of course, that's just 2 injury prevention categories we covered today. There are also many others. There are the unintentional injuries that we see, such as falls in the elderly and poisonings and drownings. And there are also many intentional injury categories, such as elder abuse and intimate partner violence, the suicides, homicides, and of course, your field in child maltreatment.
Yeah, Chan, we're doing some really interesting work right now in the area of child maltreatment. We're going to several counties around the state of Georgia, and we're holding focus groups with adult survivors of child maltreatment. And we're learning from them how their quality of life has been impacted by the abuse they experienced as kids. And it's really some very interesting results. These people are experiencing chronic diseases throughout their entire life because of the abuse they suffered as kids.
That really shows the importance of injury prevention in all these categories. Well, next week we're going to go over another area of expertise that you have, and that is healthcare reform.
Absolutely. It's one of my favorite topics, and really important for us to continue this discussion about healthcare reform. As you know, the legislation passed earlier this year, but because we had this very important November election, we could see some changes in that legislation. So we'll be talking about the pros and cons of what's been passed so far.
Well, that's a good reason for us to all tune in to the next episode of PHI Public Health Impact.